So cold weather in extremely cold climates definitely has an impact on diabetes. So usually Indian winters are quite pleasant in most of India, and actually that's a nicer part of the year. However, there's a spell in North India for a few weeks which can be really harsh, and it's harsh for diabetics too. Particularly now that pollution has increased so much that the sun hardly breaks through. So therefore you have often weeks of cold and gray days. And definitely that can have an impact on many conditions, including diabetes. So I think what happens in cold weather actually is that people change their lifestyle. So one of the things that happens is that we stop exercising. Okay, so very often the warmth of the blanket is a strong pull, and people really don't want to step out of the house. So I think that is an important change that happens during winter. And also, if you add to that the pollution levels that are around us, people often stay away from outdoors in winter. So how should we tackle that? We should tackle that by increasing our indoor exercise. The other thing that happens in this situation is that people change their food habits. We all love food during winter. People say, it used to be said, that's the time you really enjoy good food. You enjoy the goodies, you enjoy sweets, you enjoy more of fat, more of fried stuff. Because we used to be told, the body can digest things better in winter. But actually, that can be a problem. For a person with diabetes, it's a particular challenge. And that is the sugars tend to go up. And not only that, if you're not careful, you'll put on weight. And you put on weight, then even if you are careful later on, the impact on diabetes will continue. So it is important to make healthy choices. And one of the best ways is you have so much more vegetables, so many choices, so much more choice in vegetables in the winter. If you are good with your intake of vegetables and stuff yourself with more of vegetables and salads and limit your intake of sweet and fried food, you will go through winter very well, because in summer you don't get the same quality of vegetables as you get in winter. So I think we need to shift the focus a little bit. Have your food, have your goodies also, but really you have to contain the amounts. The third issue that people face often, the change that happens, is that we don't feel thirsty in winter. If you don't feel thirsty in winter, we have less water. If you have less water, if you have diabetes, your chances of getting dehydrated are much higher. And that can be a serious issue, especially if you're an uncontrolled diabetic or you're an insulin requiring diabetic. It's very important not to get dehydrated. So ensure consciously, even if you are not feeling thirsty, make sure you have enough water for the day so that you keep healthy. And the last in this, I think, is the issue of alcohol. Because it is winter and everyone enjoys, or many people enjoy a drink, and it's also the festive season and holidays. So often people tend to go overboard on the alcohol. And I think it's important to avoid that. Poor control of diabetes can affect any organ, but winter is usually short. Which are the organs particularly at risk? And these are the organs where blood flow is critical. So for example, feet. Now feet are something which are very important for someone with diabetes. We always say, love your feet as you love your face. You spend so much time in front of the mirror fixing everything. Spend a few seconds on your feet, which means the feet should not be dry or cracked, as they often tend to be during winter. At the same time, after you take a shower, make sure you don't leave them moist either, like overtly wet or moist. So you need to keep your feet clean. You need to change your socks regularly. You need to inspect your feet carefully for any corns, callosities, etc., but also for a change in color. What happens in winter is that the blood vessels get constricted, and because of that there's reduction in blood flow sometimes. So if you have vessels that are already diseased, if you're a person with diabetes whose blood flow to the feet is already compromised, during winter that problem is aggravated. And a little greater compromise in blood flow can actually produce serious issues like pain in the feet, a phenomenon called claudication, and even, God forbid, even gangrene. So you need to be careful about your feet, in particular if you are already suffering from a foot problem or a vascular problem. Do not forget to inspect your feet every day when you get out of bed in the morning and at night when you go to sleep. It's a 5-second job, but it needs to be done. So actually diabetes and heart have a very strong link. People with diabetes tend to get much greater heart issues, heart problems. And this is aggravated in winter because when you go out in extreme cold, the same blood flow constriction can happen, right? So it's important for people with diabetes and concomitant heart disease, or those at high risk for heart disease, to avoid those spells of extreme cold. You go for your walk, but go when it's a little warmer, when the sun is out. You should not perhaps do those 5 a.m. walks during a spell of really cold winter. So I think we need to be cautious about that.